coronavirus can't survive in temperatures over 70. There's people that believe that heat will kill it off.
70 centigrade or 70 Fahrenheit?
70 Fahrenheit.
Well, body temperature is 98.6 on average. It does pretty well in humans, so I think 70 is a pretty bad number.
Blood type A positive is more susceptible to the coronavirus.
This is a good one. So there's this is not a yes and no question.
Nor should they be.
There was a study of several thousand COVID patients in China, and there was a little excess of A and AB in it, and the sample size was so big that it was statistically significant. It's totally clinically irrelevant. The difference in the risk is microscopic, but if you do a big enough sample, you can make it statistically significant. We don't always care about statistical significance. We care about whether it makes a difference to people who might get infected. It doesn't.
Exposure to strong UV light can kill the virus.
There are UV wavelengths that are very good at sterilization and disinfection, and there are hospitals and other settings around the country and around the world using UV for terminal disinfection of patient care areas and whatnot. There's a very interesting process for killing viruses in plasma that uses ultraviolet light. It's specific frequencies and specific durations of exposure, and it's not a trivial thing. You can't go out and buy a black light and be safe. So true, but probably not relevant to most of the population in the short run.
Alcohol and chlorine on your body can kill the virus if you wash in it.
Yes, and we're using alcohol-based hand sanitizers all the time, and I'm not supposed to make jokes about the comparative palatability of the hand sanitizer and the whiskey made at the distilleries that have been repurposed for hand sanitizer. I've been told I'm not allowed to do that.
All right, thank you.
And dilute bleach has been used in many venues for environmental and personal disinfection for years and years and years. Alcohol's better than bleach. Bleach is more toxic. You shouldn't be rubbing yourself down with bleach. That's a bad idea. But 70% alcohol and up as hand sanitizer is very effective.
Pneumonia vaccines, or is it Plaquenil?
Plaquenil.
Plaquenil. Can treat COVID. And I know that there's a lot of people who have rheumatoid arthritis or lupus who are really concerned because they're running out of stock.
Yeah, totally unfounded at this point. There are in vitro and animal data that suggests that hydroxychloroquine, Plaquenil, or chloroquine, a malaria drug, they're like not twin siblings, but they're siblings, may be effective. Clinical trials are being set up and run, and we'll find out. In the meantime, don't take it. There are at least 2 deaths that I'm aware of in the United States, people taking chloroquine, and you pointed out that the people who definitely need it, people with lupus and other rheumatic diseases, are having trouble filling their prescriptions when we know it works for them. And we've heard about healthcare providers hoarding the drug and that sort of thing. People just have to be patient. I understand the urge to do something, but people with lupus and other rheumatic diseases need their medication. It has not been proven to work in this indication, and we need to wait a little while, a few weeks, to have a better idea.
You will be healthier if you're rinsing your nose with saline.
I have no idea.
And avoiding dairy products is good to keep COVID virus away.
I think it's interesting that Americans and human beings are the only animals that drink milk after they're weaned. I've never been a big fan of dairy unless you're talking about a really sharp blue cheese. No evidence that it's going to help in the pandemic.